combining modern medicine with old-fashioned care. River's Edge Veterinary Hospital.
Hello, mine is a face that may be familiar to many of you, but for those our new friends, I'm Dr. Carla Cunningham, and I'm the owner of River's Edge Veterinary Hospital, where we've been serving the pets of Southern Illinois and Western Kentucky since 2007. And I'd like to introduce a new face. This is Dr. Russell B. Jones, my new associate. We're welcoming him to River's Edge. We're both committed to providing your four-legged family friends the best possible care. I'd like to take a minute to give you the nickel tour of River's Edge Veterinary Hospital. Well, here we are in our exam room, and for those of you that have been with us before, this room is very, very familiar, and we're going to let you see beyond the exam room. But for those of you that haven't visited us before, we just wanted to take a minute to let you know what we do in exam. Dr. Jones and I want to be very thorough and make sure we address all of your pets' health care needs. When you first come in the exam room, one of my assistants, like Ellen, is going to ask you some questions about things that may be concerning to you and make sure that we know about that before we even come in the room. For most dogs, we always recommend a heartworm test, which we're not going to do to Buck this right now. He's already had his today. But I'm just going to go over what we do for an exam. First thing, we always try to let you know what we're looking for and what we see, whether that's good or bad. Now, dental health is very important. We'll be talking to that in future blogs. We're going to check their teeth and their gums, make sure their color's good and their teeth are not diseased. I always want to look in their eyes. If I see any problems, I'd switch this to an ophthalmic head, but his eyes look fine. A lot of dogs and cats have ear infections, so we're always making sure we look in their ears.
That's a boy.
His look great.
That's a good boy.
Next, we move on to the rest of their body. Always want to feel their lymph nodes and make sure that those aren't enlarged. Always check and make sure that their weight is appropriate. A lot of dogs and cats in this country having a weight problem, so whether that's overweight or underweight, most of the time it's an overweight problem. Those can lead to serious health issues, so again, look for future videos and blogs about that. Want to listen to their heart, make sure their rate's good, we don't hear any arrhythmia or murmur. Buck feels good and feels fine. Don't hear any problems in there. Make sure the lungs aren't congested. Normal. Feel their bellies, make sure that there's no abnormal sized organs in there and that they're nice, not painful. Check their pulses, check their knees and their legs. And that concludes our exam for today. And this is our OR, where we do almost all of our surgeries. One really cool thing that I love is our surgical laser. And maybe in a future video, we'll actually demonstrate the laser on a surgery. But what the laser does is we use the laser to make incisions instead of a scalpel. And the advantages for that is less bleeding, less swelling, which means quicker recovery time and less pain after the surgery. So I really love our surgical laser. Over here on this wall, which is our new surgical monitor that we can monitor heart rate and rhythms, blood pressure, oxygen perforation in the blood, respiratory rates, temperature, anything that your human anesthesiologist monitors, we monitor too. So we do everything that we can to make sure that your pet is as safe as possible when they're under our general anesthesia. This machine is one of our anesthesia machines. In our corner is our dental equipment that we use to do really high quality dental work. We're very proud of that, and that's another thing that we'll be talking about in a future video. And just outside the OR is our treatment area and places where we keep most of our small animals and really sick animals. Little Izzy here is on IV fluids, and we've got a fluid pump just like you see at the hospital. Make sure she's getting the right rate. And little dog, she's about 4 pounds. We want to make sure we don't give her too many fluids and make sure she's getting enough. So this pump is very important for that. All of our cages are stainless steel so they can be disinfected, and really this is kind of the heart of the hospital where everything kind of comes together. So we just wanted you to see what's beyond the exam room. And finally, here in the back of the hospital, this is our big dog runs where we keep dogs that won't fit in our cages up front. This is where they stay when they're getting ready for surgeries. I've had some interesting creatures back here. Most of the time they're canines, but I've had a black or a red-tailed hawk, which I don't do birds, so I'm not plugging that, but that was a cool experience. We've had white-tailed deer and a few calves. So these runs have been used for other things besides dog, but most of the time they're dogs, and that's certainly what I feel most comfortable treating. So, well, thank you for joining us today for a nickel tour of River's Edge Veterinary Hospital. We welcome you to come visit us again, and if you've not come visit us, we would welcome to have you. We want you to know that we take our mission very seriously, and that is to provide education and strive to provide lifelong relationships with our clients while promising quality medicine, thoroughness, and compassion to our patients. Thanks.
Combining modern medicine with old-fashioned care. River's Edge Veterinary Hospital.